At 69. Well, first it was your soda. That was too big. Now New York becomes the first American state, city I should say, to require salt warnings on chain restaurant menus. Lauria Roman is with us, and she's with the Salt Institute. And she comes to us today from my favorite place in the whole of America, Naples, Florida. Now, Laura, you say that a high salt diet is not necessarily bad for you. Is that correct?
Well, it's as if the New York City bureaucrats and the federal bureaucrats haven't picked up a medical journal article in about a decade, because I guess, Stuart, you probably wouldn't be surprised if I told you that the government was about a decade behind on their research. But research shows that Americans already eat right about in actually the low end of the safe range of sodium consumption, which is about 3,000 milligrams to 7,000 milligrams a day. Americans eat around 3,400 milligrams right now. 3,400
milligrams of salt. Is that about a teaspoon? That's about it?
It's a little over, but if we all ate what the government told us to eat, we would all have a higher rate of heart attacks and an earlier death. It would be dangerous if we actually did eat what the government told us to eat when it came to sodium. Their recommendations are too low, they're outdated, they're not based in science, and it does seem that none of them have picked up any peer-reviewed medical journals in a very long time.
So if a high salt diet is not necessarily bad for you, how about a low salt diet? Is that bad for you, necessarily?
Well, the research shows clearly that a low-salt diet is much more dangerous for you than a high-salt diet. The safe range seems to be between 3,000 and 7,000 milligrams a day. The government would have people at 1,500 milligrams to 2,300 milligrams. And luckily, none of us do what the government says, or we would be in trouble. I do worry about people who are kind of captive and cannot go seek out, they can't seek out naturally what their body wants them to seek out in sodium. So I worry about people in nursing homes. I worry about kids who get more than one of their meals from a public school lunch program, which may not have enough sodium in it. For the rest of us, it appears that we answer to a higher authority than New York City or federal government bureaucrats. It does appear that, like animals, we subconsciously seek out just about the right amount of salt during our day. And we know this from numerous studies in many countries. In 40 different countries, hundreds of thousands of people, we're all eating in the safe range.
Laurie, I'm sorry, I'm up against a hard break, and I don't want to cut you off, but we'll end it now. And thanks very much for joining us today from Naples.